Welcome to the Fearless Aging Podcast, where we interview top mind, body, and spiritual wellness experts, give you proven tips and strategies that you can implement immediately to greatly improve your overall health and well-being so you can avoid disease and old age and live an energetic, vital, long life.
Hello, I'm Rico Cavella, creator of the Ageless Living Lifestyle. If you are concerned about premature aging and you want to avoid disease and old age and you want to live a more healthy, energetic, and vital long life, I have proven solutions for you. So number one, go to agelesslivinglifestyle.com and take our aging quiz to see how well you are doing. And number two, book your free coaching session with me to discuss your wellness challenges, and I promise to get you going on the right track. You can transform your health and your life, and I can help. Hello, this is Rico Cavella, and this is the Fearless Aging Podcast, where in every episode, my guests and I, we strive to offer you proven tips and strategies that can greatly improve your overall health and well-being. And we're here to inspire you and empower you to become your best self so you can go out in the world and make a bigger positive difference. And we definitely need more people to step up and to do that. And before I introduce our expert guest today, and the title of today's, which is a really important episode, I have a question for you. If you're wondering how well you are aging, well, I have the answer for you. If you go to our main website, agelesslivinglifestyle.com, and you can take our aging quiz, and you'll find out how well you are aging. And if you don't like the results, if you're not doing as well as you would like to, I offer you a free coaching session where we can discuss all the challenges that you're having, and I'll do my best to get you back on track. So just go to agelesslivinglifestyle.com and take our aging quiz. So the title of today's episode is Natural Solutions for Chronic Pain and Inflammation. And our expert guest is Dr. Joshua Levitt. He's a naturopathic physician, co-founder and medical director of Up Wellness. He is passionate about sharing natural solutions to common, chronic, and complex medical problems like pain and inflammation. So that's what we're going to be talking about. You're going to get some really good information that can really help and change you, because pain and inflammation, those are the two big things really that so many people are dealing with. So Dr. Joshua Levitt, thanks so much for being here.
It is my pleasure to be here. This is going to be a fun conversation. I look forward to it.
Yeah, absolutely. Well, first, let's start off and tell us just a little bit. I see that you are a naturopathic physician, but how did you decide that what you were going to focus on is really, finding natural solutions to all these common and chronic problems that we're having?
Yeah, so I came to this, it was sort of a circuitous path. I'll give you the short story. I went to UCLA as an undergraduate and I studied neurophysiology there. That was I was one of those kids that always wanted to be a doctor. I come from a family of doctors. And then things went kind of sideways when I started to learn from many doctors that I was close to, that being a physician was a lot different as I was coming up through the ranks than it was when they were. And they were sort of discouraging of me careers in medicine because big insurance, big pharma were exerting all this influence on Western medicine as we know it today. And that turned out to be a very sobering reality. Mm-hmm. So anyway, I decided to take a year off after college and travel around the world. And I did that. And when I did that, I realized that there's all sorts of medicine being practiced in all sorts of ways that's very different than the conventional Western medicine that I was so familiar with. Herbal medicine, Ayurvedic medicine in India, homeopathic medicine, all these different versions of medicine that were just new and interesting to me. And that idea that I could kind of create a practice in natural medicine with a focus on nutrition, with a focus on herbal medicine, and these sort of nature-based therapies just lit a fire in me that's still burning really strongly right now. So fast forward 25 years, I have a clinical practice here in the state of Connecticut where I live. There's 6 doctors there, so I'm a sort of a clinic director and owner there. And then I've also started a company in the natural product space that you mentioned at the top of the hour here, called Up Wellness. And all of those things conspired together to give me, I suppose at this point, it's 25 years of experience dealing with people who have all sorts of medical problems. But I would have to say that one of the most common things that comes trotting into my office is people who have pain and inflammation in their musculoskeletal system. So it wasn't
Yeah.
really even a decision to get into it. It was just by necessity. So much suffering with musculoskeletal pain that it became an area of intense focus and expertise for me. That's how it came about.
Yeah, I love that, and thank you for that. We need more people like yourself. And so I think what the main message here to our audience is that there are lots of natural solutions, and actually solutions that get the body in a state where the body can heal itself, because only the body can heal itself. Drugs and all the surgeries and all these things, that they don't heal the body; they just mostly mask symptoms, and they don't really address what the root cause is, and that's what you're doing. So, I like to say that we need to let people know that what's known today as alternative medicine, that is really should be mainstream medicine, and drugs and surgery and all this stuff. What mainstream medicine does, that's an alternative. That should be alternative, and hopefully we're moving in that way.
Yeah, you're so right about that. I mean, I think a lot of what we're going to talk about here today, and certainly the sort of stuff that I talk about with my patients, shouldn't really be considered alternative. Really, it's just
That's
sort of
right.
commonsensical. I mean, you could think about it, and I want to be clear to your listeners that when we say things like drugs and surgery, right, it kind of has a negative connotation to it, right? And I can go on the record and say that there's lots of drugs that are inappropriately prescribed or used for longer durations, or just plain a bad idea in some cases. There's also lots to say about surgeries and the exorbitant amounts of unnecessary or inappropriate surgeries that are done. So, but I want to make the listeners understand that, like, just because we talk about the reality that there are inappropriate or unnecessary drugs or inappropriate or unnecessary surgeries, that does not mean that they are all bad. When you
Right.
really need your hip replaced, after a fracture, if you have severe end stage disease, that can be a miracle and it can be a beautiful thing. But if something natural like a dietary change or a movement-based therapy or an herbal supplement could have done the job to get you out of pain and get you back moving again, and then of course that's what you should do first. It's like a hierarchy, right? A ladder of therapeutics. Start at the lower rungs and then work
Right.
your way up as
Yeah.
needed. That's where I'm coming from.
Yeah, absolutely. I totally agree completely. Yeah, we always want to let people know that, for acute situations, especially, you get into an accident, mainstream medicine is fantastic. They can put you back together and save your life. And
Yeah.
there's definitely cases when drugs and surgery and all their allopathic medicine is really helpful. There's no question about it. But really, what you offer and what we're talking about is what our mainstream uh, uh, healthcare should be all about. All right, so well, let's talk about uh, what's maybe talk about what you've discovered are some of the really root causes of most people's pain and inflammation in the body.
Yeah, absolutely. I'm happy to. I think that conversation probably starts with a discussion about inflammation itself, right? So it's a buzzword, it's on the cover of Time magazine, that sort of thing. Inflammation, it's known to be a root cause of so many diseases, including musculoskeletal pain, autoimmune diseases, whole bunch of cancers, neurodegenerative diseases. So inflammation. So let's talk about that briefly, and then we'll talk about how we kind of try to find solutions there. So
Mhm.
inflammation is a natural biological process. And it's easy to think that we should just suppress it. Inflammation is bad. It's the root cause of all diseases. Inflammation is not bad. Inflammation is necessary. It's a fundamental biological imperative. We need inflammation. It's how we respond to injury. It's how we respond to infection. By its very nature, it's how we heal, right? Now, the problem comes in when that inflammatory response is excessive. Now, an inflammatory response will get kicked up by your immune system. It's an immune system reaction to anything that's injurious, right? It could be a mosquito bite or a bee sting or a stubbed toe or a chronic degenerative disease. Your body's going to inflame as a response, which is a part of the healing process. But if that response is excessive, that's when we get into trouble. And I like to use the metaphor, really an analogy here about fire, right? So fire, it's interesting, right? Inflammation, inflammo means fire in Latin. It means to set ablaze. The root word of inflammation is named after fire. And just like fire, which we need, we use it for candlelit dinners, we use it to keep ourselves warm, we use it to cook. Fire is fundamental and necessary. It's responsible for our civilization as we know it. But when fire gets out of control, when the campfire leaves the fire pit, or when the candlelit dinner, catches the curtains on fire, well, all hell breaks loose, right? And fire can be a most destructive force in the world, right? So inflammation is very similar. When it's contained and controlled, it's a necessary biological part of our healing response. When it's excessive and out of control, it can be devastating. So that's inflammation just in general. And now, is that helpful? Is that a helpful construct?
So what are some of the reasons that our inflammation just becomes out of control in our body?
Yeah, that's the perfect question to what I just said there, which is why would it get out of control, right? Why would the campfire escape the fire pit? And it largely comes down to the way we eat and the way we live our lives, right? Diet and lifestyle are fundamental here.
Lifestyle,
yeah, absolutely. So there's many, if you get a mosquito bite or a bee sting or you stub your toe, you want an inflammatory response. You just don't want an excessive one. Now, the excessive nature of the inflammatory response is largely happening because people eat the wrong foods. And that means that they eat too much of the wrong stuff and not enough of the right stuff. And I know you know all about this, right? Essential fatty acids of the omega-3 variety are good, whereas the omega-6s from refined seed oils and highly processed foods are bad, right? So not enough of the good stuff, too much of the bad stuff is a really, really important part of it. Excessive sugar, excessive, carbohydrates, simple carbohydrates in the diet can promote inflammation. So there's a bunch of dietary things, and many people are getting that terribly wrong, which leads to an increase in an inflammatory response, no matter what the stimulus. And then lifestyle wise, there's a whole bunch of categories there too that are also associated with reduced inflammatory responses. Good sleep, appropriate amounts and duration of exercise, stress management, including even psychological things. There's a fascinating study that came out of the University of Berkeley a few years ago, California at Berkeley, where they talked about people who experience awe, who just go around the world and notice that things are awesome, whether it's a mountain or an ocean or a lake or a river or your dog. More awe leads to decreased inflammatory chemicals in your bloodstream. So when we live in that kind of harmonious way, there's less inflammation. So those are the reasons that inflammation gets out of control.
Yeah, and we know, what manifests in our mental emotional state. I mean, what first starts in our mental emotional state is what manifests in our physical body. So all these things, all this fear and negativity and stress, all these things are precursors to I think causing the body to overreact and to depress our immune system, right?
Yeah, absolutely. And it's easy to think that just like being in a fear-based state or an anger-based state or anxiety, those sorts of things are just purely psychological. But as you well know, the mind and the body are not two separate entities, right? They are one and the same, and they work together. And so it's sort of remarkable to think that experiencing awe or joy or happiness, contentment, love, these kinds of positive emotions, it's not just emotional. It affects your physical body as well. And there is no question in my mind, having decades of experience with people with musculoskeletal pain, that those who are in a healthy mindset, right, and who are sleeping well and eating well will have less pain and disability from the same problem as a person who is living in anger and living in fear and all that sort of stuff. There's no question about it. So
all those things depress our immune system. And I think where all that stems from, I always like to point out, that we know that everything in the universe is made up of energy, vibration of energy, and we're vibrating beings. And all these things, any kind of negativity or any kind of fear or anger and all those kind of things lower our vibration, and that lowers our immune system. And that's what causes, that's a real big precursor to most all the chronic illnesses that we experience in our body.
Yeah, you
So
reminded me with your comments there about vibration and energy. You know, even another thing is connectivity to nature. You know, I'm a naturopathic doctor and feel
yeah.
that like there's a lot of wisdom in nature. I go hiking every
Oh,
day. I'm an old surfer. I grew up in Southern California as a surfer, really connecting to
oh, you
nature.
do?
And it turns out that there's energy there too. There's even a new and burgeoning science about grounding, connecting to the earth in a physical way, like an electrical way, with bare feet on the sand or on the earth.
I do
You
that
know,
all the time. Yeah, I try
sounds
and
like an
walk
old
barefoot.
tree hugger thing to say, but but this is there's a real physiologic effects there. So it's
Yeah.
important stuff.
Yeah, I mean, we just got so far away from, you know, from we're not separate from nature. We're part of nature ourselves, and we got
Yeah.
so away from nature and thinking that we're different than nature. That's one of the biggest problems. So yeah, I mean, anyone can just experience it. I mean, you're in the city and all the electromagnetic fields and all the things going on and all the stress, and just go out and get out into nature and walk out in the forest, and you can just feel a calm, and you can just feel that energy and feel that connection to the energy of nature. Absolutely. It's one of the very best things you could possibly do.
Absolutely. And there's even studies about this. In Japan, they call it Shrinin Yoku. Now, I don't speak Japanese, so I probably butchered the pronunciation there, but it stands for, it means forest bathing. They talk about bathing in the forest, not taking a
Yeah,
bath, but just bathing in the green and the filtered green light from the
right.
forest. And
That's right.
it has profound physiologic effects: calm, lowers cortisol levels, decreases inflammation, and promotes sleep. I mean, yeah, we need to connect in. And you know, there's a lot more to a treatment protocol for someone with arthritis than just going out in the forest and connecting to nature. We can get into the details, but I'm really glad we started there because it's so important and so often overlooked.
Isn't it interesting that just really the basic common sense things are really what we need? We just need to get more oxygen. We need to get out in the sun. We need to appreciate, you know, just being out in nature and being alive and having, like say, being in awe and being just amazed by our world and just being open to all these things, just the basic natural things that we need to do: eat whole
Yeah.
foods and sleep and breathe. That's kind of what I've done with my ageless living lifestyle. I kind of boiled it down to learning how to master the 7 essentials of life. We have to breathe, we have to drink water, we have to eat food, we have to limit the products, we have to sleep, we have to move, and we have to enjoy, have fun. So,
Yeah.
but we're never taught how to master all those most essential things.
Yeah, you're right.
That's it.
Yeah. Amen is what I would say to that. Yeah, yeah, we're speaking the same language for sure. And I think we also it's easy. I think we live in this world where we kind of consume, right? You know, we consume, we've separated ourselves from nature, try to insulate ourselves from it, and then rely on technology. And again, technology can be fantastic. It's what allows us to communicate at great distance in this phenomenal way. It's what allows remarkable advances in communication and medicine, but it also leads to this over reliance, right? On the technology as the cure, right? So like people have, let's just say, knee pain, for example. And then the idea is that it's just the doctor's problem, right? They're going to go to the doctor, they're going to get an
Yeah.
MRI, and they're going to get drugs and then an injection and then a surgery, as if they don't have any of their own purchase over that problem. And part of what I'm educating my patients and all of my readers and customers about is that you have ownership. It's your knee. You know, there's some things that you can do there, and that's kind of where the rubber meets the road.
I mean, we're just so on the same page. That's one of the points of my ageless living lifestyle is you got to take responsibility for your health, just like in everything in your life. If you don't take responsibility for it, it's not going to happen. And
Yeah,
if you don't take responsibility, you're giving up your power. So
yeah,
then you're a victim, you know. So everything in our life, if we take responsibility for it, then that makes us a powerful person,
yeah.
and we have control over our life. Just what you say.
And I think there's a powerful statement there. You know, I mentioned the MRI of the knee, and as you said, that taking back your power. I think part of that is about educating people, you know, so that they can, because knowledge is power, right? So when you have knowledge, and let's talk about that for a minute, because I know that a lot of your listeners will have evidence in their life before of having gone to a doctor with maybe back pain, for example, or neck pain, or knee or hip pain, and then gone into that cycle of going to see an orthopedist who then orders an image like an X-ray or an MRI. And many of these people will have found out that there was something like a herniated or bulging disc in their neck or back, or they might have found out that there was a tear, a chronic degenerative tear in their meniscus in their knee. And when people hear that, it's like, wow, we had this amazing technology that looked inside my body and saw that something was broken, torn, bulging, herniated, or whatever. And then they feel awful. They feel like, oh, this now is something that needs to be fixed. Explains my problem set. And now the surgeon offers this solution, which is usually going to be surgery. Well, it turns out that there are hundreds of thousands, perhaps millions of people who have herniated discs in their spines who have no pain at all.
Right.
There are equal numbers of people who have meniscus tears in their knees who have no pain at all. So just because something doesn't look right on an MRI does not mean that you have pain, and certainly does not mean that you need surgery. So we've created this kind of, it's almost like a pyramid scheme or something. You know, we like do an MRI. Whoa, you have a disc herniation. That explains your pain. Why didn't the doctor tell you that there are many, many people just like you who have that exact same disc herniation who do not have any pain? And I think that's a little bit of education that is knowledge, right? That leads to power to say, no, I'm not going to get surgery right now. I'm going to try a few other things first. And that's where I come in.
Yeah, exactly. That's so good. Well, I know you have a protocol that you call SURF, which is what's the term for that? A surf?
Yeah. So like I mentioned earlier that surf is well, a sport that I love. I'm an old surfer, and so it's a convenient acronym.
That's what I was thinking.
Yeah, it's a convenient acronym for a protocol that I employ in musculoskeletal pain care. And the S stands for stretching exercises. The U stands for unlocking, which is releasing trigger points, which are these like tension and muscle trigger points that can be released in any number of different ways. Much of this can be done totally yourself. The R stands for resistance training, a big thing that I think you're into too, which is strength, right? Muscles need resistance to build strength and power. And so we have S for stretching, U for unlocking, R for resistance, and F for functional movement. So this is a movement-based protocol that employs all of those techniques to get people out of pain. And when you couple that with, anti-inflammatory herbal medicines, muscle relaxation with minerals, vitamins, and whatnot, we could talk specifically about that. You have a recipe for a pain relief protocol that really, really works, even in cases that an orthopedist would have said was a lost cause.
Yeah, absolutely. And then add to that what you call down-to-earth eating. Talk a little bit about your down-to-earth eating protocol.
Yeah, so you mentioned food as one of the 7 sort of foundations of your protocol, and it's certainly one of the foundations of mine as well. And the way I've described it, yeah, down to earth. So down to earth, I like the term, right? Because down to earth is a personality characteristic of someone who's approachable and easy, and down to earth also kind of reeks of environmental consciousness and sensitivity to our planet, right? And if you think about the earth, that's where the food's supposed to come from, right? So whether it's the farm or the field or maybe the fishery, down to earth eating to me means eating minimally processed foods that come from the earth in a form that is really as close as possible to the form that it existed in the farm or the field or the fishery, right? So that means shopping like around the perimeter of the grocery store, right? Like where there's produce, it's like, oh, this is a leaf, this is a fruit, this is a root or a tuber, this is a fish, this is, you get the idea, right? Shopping around the perimeter. Whereas all the stuff in the middle are highly processed foods with ingredients sourced from all over the world, processed with synthetic colors and preservatives and additives to make these highly palatable foods that really have no business in a dietary protocol. So that's what down to earth eating means to me.
Yeah, so mostly you want to make your diet out of whole foods. Whole foods, what I call real food, is food that's grown in nature. It doesn't come with a package or a label, Although, I mean, these days there's some packaged foods that are okay to eat and helpful, when we're in a rush and all that sort of thing. But yeah, just eat as much raw food and as much whole foods as you possibly. I got to tell you this is so funny. I remember way back, is it maybe in the 80s? I don't know, 90s. When just more health food stores were coming out and more health food was becoming a little bit bigger of a thing. And I remember going into one of these big supermarkets, and in the middle they had this one little little table with some stacked up some products, and they had a big sign that said health food. And it just struck me. I don't think anybody else got it, but so the only health food is on this little table here. And
Yeah.
what's the rest of all this stuff? It's unhealth food. All
I
the
know.
other things, but here we got something that's good for your health. But all this is just, well, I don't know what. It's
Right.
so fun. It just
For your
cracked me up.
disease.
Yeah.
You're reminding me of a funny thing that I saw, because I was struck in a very similar way. I went in to a pharmacy and I saw this section, and this is also in grocery stores too. I've seen this repeatedly, where there's a sign over a bunch of these processed food products that says suitable for diabetics, or this is like a diabetic section. And in this section is all this candy. It's like all this candy and crap. And what it is, though, is candy that's made with sugar-free sweeteners, right? So it's like, there's many different sugar-free sweeteners that are out there now, but whether it's aspartame,
they're carcinogenic and stuff,
all
right?
these things. And this is the section for diabetics, right? It's like all the candy filled with all this crap. And I'm thinking like, the section for diabetics is over there in the produce, right? It's like it's the real foods. It's not this highly processed crap that has stuff that tastes like sugar that doesn't raise your blood sugar. I mean, of course, I get what they're doing with that, but I had the same kind of reaction to you when I saw that. It's like, really, this is what you're giving to the diabetics? This is the worst foods in this whole place.
Yeah, that's so funny. Well, as we were talking earlier too, before we came on, unfortunately, our whole system is still based on bottom line of company, how much money they can make, not what the best product they can offer to people. And they're not concerned about the health of the individuals and the health of the planet. It's just how much product can they sell to make how much money. So that's what's got to change, but it can change. So as we talk, you have to take responsibility and get educated and realize, what your body really needs and what's going to make you well.
And there's another point to add in there too. I would say that, like, because I have a lot of expertise, and as you know, and I'm not here to pitch anything, but I manufacture and formulate a lot of herbal supplements, for various different problems, including musculoskeletal pain, digestive problems, and whatnot. But it's really interesting because these products, of course, they're much less expensive than pharmaceuticals, but they're natural products, right? So they're made with ingredients that come from the earth, things like turmeric, which we could talk more about if you want, or boswellia, magnesium, vitamins, minerals, these sorts of things. And these sorts of things are not patentable, right? So there's not a lot of money to be made in securing the intellectual property, so only I can sell it, right? They're natural products. Anybody can make these sorts of things. But big pharma and the big research industrial complex that studies and produces a lot of the science is really only interested in patenting things that they can protect for a while to sell, like a drug, for example. And so you don't see the same level of research interest in natural products. And that's very unfortunate. And the reason for that is it's just follow the money, right? If there's not a patent to earn after the research shows that an herbal medicine does something, then no one's going to want to fund a big expensive trial to study that thing if they're not going to be able to get their money back at the end of the day. And so you wind up with a whole industry of nutritional and herbal supplements, some of which are really high quality, like the ones that I make, and some of which are not, because there's not as much scrutiny, from the powers that be over these things. So yeah, it's another interesting thing. It's true. You got to follow the bucks.
Yeah, that's well said. Well, again, that is an important point as well. Unfortunately, again, there's people that are honest and really trying to put out the very best product, and some people are just putting, whether they're natural products or not, are just putting out a product to see how much money they can make. So you got to be careful too. You got to know who you're dealing with. And so, tell us a little bit about your line of product. I know your website is called Up Wellness, where we have talk a little bit about the products and what kind of a chronic problems that they address.
Sure. Yeah. And I'll start with the name of the company, because it's kind of a funny name, right? Up Wellness. Obviously the term wellness is familiar to you and your listeners, but we've mentioned a couple of times the sport of surfing, which is my favorite. And anybody who's ever been in a large body of water, the ocean in particular, but lakes will happen too. There's this phenomenon where you get to a cold patch. You've probably experienced this before. There's like, wow, you're swimming along, and then all of a sudden, wow, it's much colder. So what that is called an upwelling, and an upwelling is a phenomenon in the ocean where nutrient rich cold water from below, from the depth, depths get circulated up to replace the nutrient depleted water at the top where all the sunlight and the biological activity is. And that's called an upwelling. It's a nutrient infusion of cold water up to the top. So we named our company Up Wellness as a nutrient-rich living company. That's a tagline there, nutrient-rich living. And it's named after a surfing phenomenon or an oceanographic phenomenon, and it has wellness in there. And yeah, so it's very close to my heart in that way. So there's a little fun share.
No, I really like that. I think I like the name anyway, because see, I was thinking of it, like up level, how you want to up level yourself.
Yeah, exactly.
So it's good. You want to up level your wellness. Yeah,
exactly.
That's pretty
so
cool.
It has that. It's like it's a great company name. If you
it is a great name.
It's a great name. Me saying. Yeah. And nutrient rich living is what it's all about. So what I've done there, and people can go to upwellness.com and take a look and see there's a whole bunch of different products that I've made that address problems in different categories with these basically protocols that I've designed from my 20 plus years of experience with patients. And so, Golden Revive Plus is our best selling product. And that's the one that I developed for people who have musculoskeletal pain. I have a product called Total Revive Plus, which is for digestive concerns. We have a probiotic that includes adaptogenic herbs called Probiotic Plus. We put plus on a lot of the names of the products. And I think they really are additive in that way. We have a couple of skin products, one of which is made with Manuka honey, which is fantastic for all sorts of different skin problems. We talked a little bit briefly, and I'll look forward to sharing it with you about this line of powders that can be added to coffee or smoothies or something like that, which is called Mojo. And Mojo, all the Mojo products in our line contain adaptogenic herbs, which help people respond to stress better and help to heal or treat any of the problems that they may have that may be related to stress. So we have chocolate flavored powder that I put in my coffee every day. We have a berry flavored powder, which is really refreshing for summertime. We have a kind of a honey vanilla flavored one that is really great for musculoskeletal pain as well. It has some collagen in it. So yeah, a whole line of different products based on my own experience that people can see at upwellness.com.
Yeah, upwellness.com. I highly recommend you go check those products out. All right. So, I always recommend people that if you go to see a doctor, I would recommend first to go see a naturopathic doctor. I mean, a mainstream medical doctor, they are good for diagnosis sometimes, but I always recommend going to see a naturopathic doctor first. So what would you say? What would be the benefits, and why would you recommend that people go to see a naturopathic doctor?
So I agree with you too. I think that naturopathic doctors should just always be considered as part of a healthcare team, right? So if a person needs a Western medical specialist, there's some, I live right down the road here from Yale, and many of my friends and colleagues are physicians in ultra specialties at Yale. So, if you need your cataract removed, I am not the person to do that. But my ophthalmologist friend, who, is a colleague right down the street, he can take care of that for you. And that's a fantastic thing. But he's unlikely to talk to you about how to maintain your eye health throughout the years, right? And the same goes for your subspecialists in cardiology, endocrinology, gastroenterology, whatever. And I don't see any reason why a naturopathic doctor with their or our focus and attention on the whole person, body, mind, and spirit, and on natural products, natural solutions for common, complex, or chronic problems shouldn't be part of everyone's healthcare team. For many people, naturopathic doctors, that is, are the first person that they should see for a problem. And if we feel like it's outside of our zone of expertise, this happens to me all the time, I'll refer them on to an appropriate specialist. Sometimes I am the person, or we are the type of doctors that people see at the end of the line. They've seen many Western doctors for all sorts of different specialties, and they're still hurting. They're still sick. And we're the ones that try to put it all together, because I think it's unfortunate. I mean, it's a great thing that an eye doctor can focus so much on glaucoma or a cataract or a retina, but they do that with blinders on, that's just what they're seeing, and they don't see the whole person. So many people come to me and they have a doctor for their eye, they have a doctor for their prostate, they have a doctor for their knee, their foot, their brain, and no one's looking at the person in whom all those body parts reside. And that's what a naturopathic doctor can do.
Wow. Well articulated, really well said. And that's the message that we want to get out to you. And also, I think the to sum up the message of our conversation today was there are lots of natural solutions for chronic pain and inflammation, and you just got to seek them out and seek some practitioners that can help you get on that path to healing, and that you don't have to live with chronic pain and inflammation all your life, and you don't have to live a life of taking prescription drugs all of your life as well. So there's lots of natural solutions out there.
Absolutely. Yeah, I made a career of it.
Well, well done. Well done. Well, thank you so much, Dr. Levitt. I really appreciate it. That was some really great information, and it's exactly the message that I'd like to get out to people. And that's what I think that's what's going to really help to end this really healthcare crisis that we have in America. So that's what we're out there doing.
I'm glad that you're here and to be able to participate in that. If it helps to move the needle for even just one person out there, then I think we did our job, and we're very much cut from the same cloth. And I'm sure that that's going to be the case. This is really fun and productive.
Yeah, thank you so much for being here. That was great.
Yeah, you
so
got it.
As always, I like to end all of our my interviews with the saying from Einstein that knowledge without action is useless. So we always bring you some great knowledge, some great information, but you got to step up and take action on it. So I highly recommend that you really pay attention to what we talked about, what Dr. Levitt offered today, and take it to heart and get out there and realize that there are natural solutions, and you see and consult with a naturopathic doctor when it's necessary. So if you enjoyed today's episode, please give us a good review and subscribe to our channel and tell your friends about the Fearless Aging podcast. And so you can do it. You just got to step up and do it. So once again, Dr. Levitt, thank you so much. That was great.
It was my pleasure.